Okay, so hello again. I will go ahead and get started. So for those that have just joined us, my name is Ashley Pappas and I'm a field representative with Nevada Medicaid. I will be facilitating the Claims Appeals Adjustments and Voids training. Our objectives today. So I am going to be going over at the end, locate our contact information and resources for troubleshooting, and allocate additional resources that will help you throughout submitting claims adjustments, appeals, or if you need to submit a void. Okay, so for claims adjustments and voids, what's very important to notice is that you want to make sure that any claim you need to make an adjustment on, so this should only be for claims that are in a paid status, only paid claims can be adjusted or voided. So if you do need to make any adjustments to a paid claim, a prior paid claim, it still does have to fall within Nevada Medicaid timely filing limits. So just because it was initially submitted within timely doesn't extend the deadline, the stale date for an adjustment. So just make sure that all adjustments are made within, for Medicaid primary, 180 days of the date of service or eligibility decision date, whichever is later. And then for out-of-state facilities, out-of-catchment providers, and those recipients that have primary coverage, whether it's Medicare or maybe another commercial plan, you do have that year timely, 365 days from the date of service, or eligibility decision date, whichever is later, to submit any adjustments to us. And then this is that little disclaimer again, only paid claims can be adjusted or voided. If your claim denies, it's essentially resubmitting a clean claim and maybe making any corrections of any errors that were listed. All right, so to adjust a claim, I am going to be jumping back and forth between the slide deck and the portal. So I want to go back here. Anytime you need to make an adjustment, we'll just go to Claims, Search Claims. And then there's a few different ways you can maybe search for a paid claim. If you have that ICN number, that claim number, that's going to be the quickest way. You can also search by the Medicaid ID and the dates of service as well. But you would want to enter that information and hit search. I am going to jump back to the slide deck. And this does just go over what I explained. You can either use the ICN or the recipient information. When a claim is found, you want to make sure that it is in a finalized payment status. You can click into the claim ID field. And then at the bottom of the screen, you'll see an option for adjust, copy, void, or print preview. If for any reason you don't see an adjust option or a void option, that could indicate that the claim is either not paid or it's already been adjusted or voided. When you open up the claim, you will want to hit adjust and it will open up the claim and it will be auto-populated with the information that's already entered. So essentially you could adjust the information that maybe you need to change. This can be, for example, maybe the billed amount you need to adjust for a different billed amount. You can do that on an adjustment claim. I would recommend, though, if you need to make adjustments to the dates of service, to just void the claim and then resubmit, because that can cause some issues if you're trying to make an adjustment to the dates. Maybe you built the wrong dates of service. You'll want to void in that case, but we'll get into the voids on the next example. So when you make any correction in this example, I would say like adjusting the billed charges, you could go into the line detail and make the modification. You'll want to save the detail and then you can hit resubmit. It'll take you to the confirmation page, so you can also take a final glance into what you have updated and confirm that's what you intended to do before you do submit it over to us. Once you do hit the submit button and the confirm button, you will receive a message that looks like this. Ideally, you want to see finalized payment again. If you're submitting an adjustment, you'll receive the new ICN number, which starts with a 59, indicating this was a provider-initiated adjustment or void. And then I do see a message here when you're talking about adjust claim, that is corrected claim, correct? And timely filing for adjusting a claim. So the adjusting a claim, it can be considered submitting a corrected claim. If the previous claim is in a paid status and maybe you need to make an adjustment, it can be for adjusting, like I said, the billed charges. Another reason to adjust could be maybe the rate was updated, so you're needing to get a higher payment. Sometimes it can happen if maybe you were overpaid by Medicaid and you need to maybe give us some money back. The timely filing for an adjusted claim is that 180 days if Medicaid is primary and 365 days if Medicaid is secondary. So you still have to submit adjustments within the Nevada Medicaid timely filing. Now for voiding a claim, it is a similar process as far as the search goes. So you can search with the paid claim ID number or with the recipient information. You would click into the ICN field, and then at the bottom again, you'll have an option for adjust, copy, void, or print. And then in this case, we have an example of where you can pull the RA, but you would want to hit void. Again, if these options are not listed, adjusted or void, it's either because the claim is in a denied status or it was already adjusted. You will get a confirmation box to determine if you are sure you want to void the claim. I do want to add this disclaimer: you should not void any payments if you're out of timely. So if for any reason you need to make an adjustment to a claim outside of timely, I would get with Nevada provider training just to determine, one, why you need to make the adjustment, because there can be some instances where primary recycles a claim maybe years later and you need to resubmit with Medicaid. But in this case, if you're still within timely filing, you can select OK. And then you will receive a message that your claim has been successfully voided. So oftentimes you will receive an ICN number as well, unless again, it has drug details on the claim, in which case the box would look exactly like this. If it's obviously an institutional claim, it would differentiate between professional and institutional. Into some resources. The first thing I want to point out is that where you registered for today's training, we do have a takeaway doc you'll be able to access. It is in the course content and resources tab. So we do have that takeaway doc that will provide links to the resources I'm going to go over on the website that you can refer back to. I am going to hop to the website and go into some resources that will be helpful for you as well. So on our provider training page, we do have a tip sheet for appeals, adjustments, and voids. I'm going to scroll all the way down here. And then we can see for last updated February 2019, the tip sheet for claims appeals. So you can use this to refer back to when you are going through submitting the claim appeal. This will just ensure that one, you include all the attachments and that you're submitting it in the correct place. The next thing I do want to go over is going to be our web announcements. So up at the top here, scroll back up, we do have our top 5 displayed, but I want to view all because we do have a web announcement 2350. And just to find that quickly, search there. And this is just a reminder for providers that are going to be submitting claims appeals. Again, it advises of the deadline and also that we need the FA90, that official claim appeal request form. You can refer back to that web announcement. And then I want to jump to our billing manual. So I'm going to go to providers and our billing information page. And I do want to open up the manual, and the chapter I want to focus on is chapter 8. I'm going to actually scroll up to the table of contents because our chapters are hyperlinked. So chapter 8 is our claims processing and beyond, and this is going to have information on timely filing as well as remittance advice information, and then also our adjustments process, and then of course the appealing time frame as well.
Hey Ashley, we do have a new question in chat. I'm not sure I understood it, so I'm not sure if we need more explanation or maybe if you can understand the request.
Okay. So should we be doing adjust a claim online versus sending a corrected claim with a standard resubmission code 7? So I believe, Michelle, you're talking about EDI claim submission, which I was actually just about to get into. So I'm going to go to our EDI page because you can submit, and again, a corrected claim. So that adjustment reason code 7, 8 would be a void, but in a 7 reason code, if you do submit through a trading partner like Change Healthcare or Availity, I do see a thumbs up, thank you. You are able to submit adjustments through your trading partner as well. That is indicated via, and I'm just going to open up our inbound companion guides here. Now, I don't want to go into too much detail with this just because this is the hand guide for your trading partner. So this actually goes into loops and segments of the EDI file. But I know oftentimes when you're completing the form, it's actually on either a UB or a CMS 1500 that you're inputting the information. So depending on the type of bill, if you are submitting an adjustment, you'll want to indicate a 7 and reference the prior ICN number that paid. And then if you need to make a void, it would be a reason code 8, and you would also include the prior ICN number of the claim that paid so we can void it. And it can be done through EDI if you choose to do that. You don't always have to go through the portal to do the void option or adjust option. Okay, and then the next thing I did want to pull up is our EVS user manual. And specifically, I do want to start in chapter 1. And this is going to be what you can refer back to for the secure correspondence. I'm going to open this up here. And then I like to use my control function to search keywords. Here we go. And then so information on secure correspondence is in section 1.15. So this will go into detail of how you can access your secure correspondence, and what you can submit through secure correspondence. I do want to open up chapter 3 as well for the claim submission because we do have separate sections for adjustments and voids that you can refer back to as well. So use that control function, and for adjustments, I believe that is 3.3. There it is. So this will just provide information on what I went over with searching and finding the claim and then adjusting it, as well as voiding it is 3.4. And then as you may have seen when I was searching, we do have a section for claims appeals as well. I believe I saw it was 3.6, yes, for appealing a claim. And again, this is in the EVS User Manual Chapter 3. It will be on your takeaway doc as well that you can access in LMS. And then the last resource I did want to point you to was the Medicaid Services Manual, and that is just going to be policy information. So where am I finding you have 30 calendar days to submit appeal, 90 calendar days to submit a fair hearing. That is in Medicaid policy. So I'm going to go to the Medicaid Services Manual, and I want Chapter 100. Always make sure you're clicking into the current effective. And then the section in MSM Chapter 1 is going to be 105.2. So I'm going to find that. There we go. 105.2C, disputing a payment. So this advises the 30 calendar days. And then I actually, for fair hearings, that is going to be a separate chapter. So let me go back. I'm going to zoom in. Because hearings is chapter 3100. So this has policy information in regards to after that adverse determination, if your claims appeal is denied, requesting a fair hearing. It also has information on how recipients can make a request for a fair hearing as well, but that is chapter 3100. So for contacting Nevada Medicaid, we do have our main customer service line. That's that 877-638-3472. I'm going to pause here and give it a moment in case you need to take that down. And then if you do need maybe a more of a one-on-one training with your designated field representative, you'll want to initiate that by sending an email to our Nevada provider training. I will post that in the chat as well. Just make sure you include your NPI. Any remaining questions, you can feel free now to unmute yourself and ask, or if you feel more comfortable posing questions in the chat, I'll continue to monitor that as well. Other than that, if you don't have any other remaining questions after you complete the survey, you are free to go. And thank you so much for spending 45 minutes with me today. And Lynn, I do see your question. Is there a way to appeal a timely denial if coverage information wasn't provided by the patient after the timely filing limit? So with that, that would be a denied appeal since the information wasn't received until after timely. When that happens, you can actually refer to Medicaid Services Manual Chapter 100. I'll pull it up because if the recipient isn't providing you their coverage information and you're searching eligibility on the Medicaid website with their name and social and nothing comes up, it is their responsibility to make sure that they are telling you of their either Medicaid active coverage or pending coverage. So it is going to be Section 105 for when you can bill a recipient, because that is essentially, if they didn't provide you the information, would fall to patient responsibility. So I'm going to go to the Medicaid Services Manual just to get that section for you. I think it's 105.3 on when you can bill a recipient, and that's, again, Medicaid Services Manual 100. Yes, Section 105.3, billing Medicaid recipients. Thank you, Sophia. And then Anna, the cheat sheet for the portal, the tip sheet is hopefully what you mean. That is under providers. Yep, that one. Perfect. So that's under providers and our provider training page. And then it's down towards the bottom. I'm going to scroll. And then February 2019 tip sheet for claims appeals. Of course.
Okay, so some patients have only emergency Medicaid for emergency services, but sometimes they're being denied for, I guess, not medically necessary. Is
Mhm.
there any, I mean, they went through the emergency room. Is there a way that we can appeal those?
So with that, when on your initial submission, for those recipients that have that EMO only coverage, unless, and hopefully you can still see my screen, I'm going to take us to our billing page because it does go into details regarding the EMO coverage and what diagnoses qualify for that bypass to avoid that denial. I
Okay,
would say, but what I typically advise my providers is if the recipient does only have that EMO only coverage, when you submit the claim, submit it with the medical documentation that supports that they would be essentially expired within 24 hours if emergency intervention wasn't
okay,
performed. So if you do that and submit with the documentation initially, that does improve your chances. Otherwise, for those appeals, I do see sometimes if providers get the initial denial and then they appeal and include the medical documentation, that can help, but it's of
okay.
course not guaranteed. But from the billing page, I just want to go down. We have at the bottom emergency only. We have an EMO only page, and this will just take us to what qualifies for EMO only services, a link to the ICD-10 emergency diagnosis list, and then of course it does reference policy and when the recipient can be billed as well.
I did put, Michelle, this is Sophia too. In chat, we have this page that is similar to what Ashley is going over, but it's like a reference guide for the ICD-10 CM code diagnosis codes. So, and if you don't find that your diagnosis code is listed on that list, it's only 12 pages, so it's not all that big. I mean, there's so many, there's thousands of ICD-10 codes, so we couldn't include all of them, but these are the most common. The top disclaimer does say additional codes may be supported as allowed. Providers, just as Ashley said, providers should provide appropriate clinical documentation supporting it. So it's likely that what's being provided isn't quite what they're looking for to support what you need or to support that emergency. if it's not one of these ICD-10 codes already on this document.
Okay, thank you.